Yeah, yeah.
That's how I got my first sight in helicopter with American One. And we were doing a live show with them in the firehouse. And I started being around with the car and goes, get in, let's go for a ride. And we used to call it the best ride.
You know, as we shut down everything, I mean, essentially everything except for
All right, ladies and gentlemen, on behalf of the Board of Montezuma County Commissioners, we have a meeting, we have an agenda today. We have a special treat, though, today. Before we get started with our regular agenda, we are going to introduce General Lowe, and he is going to give us an update, kind of what's going on through the state, and then we'll get on to our regular agenda. So, General Lowe, on behalf of the Montezuma County Commissioners, we welcome you here. Thank you.
Hey, thanks a lot. Major General Mike Lowe, the Adjutant General for... So we've been at this for a little over a month now. One of the first to report with Director Willis to the Unified Command Center. And then from the state perspective, been working very hard on fighting the COVID-19 battle. I mean, that's really it. It's a war on COVID. And so from the state level down to the local levels, it's partnering with that whole of government. National Guard comes in support, obviously, of your county, but we also come in support of other departments like public health and public safety. So with that, I'm happy to take any questions. And Mike, if you got any statements you'd like to make right now as we go forth and talk about what...
Commissioners, thanks for having us. I sure appreciate you letting us come to your county. It's so important to have the opportunity to get outside. You know, I don't get out of the State's Emergency Operations Center very often, and it's so important to be able to get out and get your perspective and the perspective of Montezuma County. So thanks for having us.
Thank you. Any staff, anybody would like to give any updates or questions at this time to General Lowe? Commissioners?
No, I would just like to give them the National Guard and Major General Lowe a hearty thank you for supplying us with two of your National Guardsmen down here to help our Emergency Operations Center and our emergency manager to help us wade our way through this whole process and this pandemic, and we're very, very appreciative of that.
And again, for me, also, it's the same thing. I appreciate you, appreciate your guys' help, appreciate the gentlemen that are here, and we're just going to keep going forward. So thank you for all your help.
Hey, the other thing that I'd just like to ask you. So now we've gone from the stay-at-home order to now safer at home. And so as we transition from stay-at-home to safer at home, what are you finding in the county that what's going to be some of the differences as we go through the next couple of weeks as we go to this next phase of this pandemic?
So, you know, we have our emergency manager here. Jim, I actually would like if you would come up and address that, as well as if you would also describe what the personnel from the National Guard are doing. Why don't you take my place right here? Okay, how we can make it work?
Can you hear me? Yeah.
Yep.
Okay. So, thank you.
I think we have a lot of challenges that we're going to be working on. That's, of course, to keep everybody safe, make sure people are 6-foot distance, try to keep that social distancing as we build up the community at 50%. We got a lot of businesses we need to do something with. I think the other challenges are going to be making sure that we don't peak this thing any higher than what it is. And I know with testing and everything else, we got to work really closely with public health and with CDPHE. We need to know what's going on, otherwise we could cause it to get worse. Our biggest concerns, of course, are the areas around us. Arizona and New Mexico and the Navajo Nation. So with those issues, we could easily spike this pretty fast, so we have to be very careful. So we're working on a plan, I think today even, and we're going to try to come up with something and get ready for, I think, Monday, hit the ground running. But yeah, we have some concerns, and because we're down in this corner, we have to keep an eye on the states that surround us as well. So, did that answer your question?
Can you describe what the two, what they're doing helping us here in the county?
The National Guard's doing it.
National Guardsmen, what they're actually doing?
Oh, yeah, your guys are doing everything I tell them to do. It's absolutely wonderful. They are putting together plans, they're doing logistics, they're doing plans, they're doing advanced planning, and they're working closely with a Rubicon person that's doing advanced planning and recovery. And that way, they're getting up to speed as well. And they're amazing. They're always coming to me saying, what do you want us to do? And I mean, they're constantly assisting me in something that wouldn't get done because I can't do it all. So, no, they're an asset. I'm hoping I can keep them until September, so you let me know if that's okay. I think they need some time off, but they are outstanding. They have been doing everything that we would like to do, and we finally can get it done because they're here to help us. So it's been outstanding. Thank you for that.
Thank you.
Hey, just a couple things that you mentioned. One is the Navajo Nation, because it's going pretty rampant in there right now. So I contacted my counterpart in Arizona, Major General Mick McGuire, and I asked him, I said, hey, Mick, I said, what do you think on that? And he just goes, hey, 6 weeks ago, I think they started out with like 20 cases. And then after 6 weeks, it's over 1,400. And then 40 deaths, and it's over that now. But this was a couple days ago, so we can see how quickly this can spread, and that's what makes it so dangerous. And so I think when you look at it, how am I going to protect myself and how am I going to protect my family is probably the biggest thing we've been working on, both from a state perspective and guidance and direction on how we do this. Obviously, phase one of this was clamp down very hard, and we've all seen that, and we've all lived it a little over a month now. And I think phase two is, okay, let's relax a little bit. Let's see how we can go out there and get about doing some life, some business and that, but also not get it out of control. And that's the biggest thing is how do we not get out of control. And so let's see how we can do that. And especially working with public health, we got some experts over there, and as she tells me, every week we're finding something new. And so it's in these challenging and uncertain times, it's good to have a great partnership and a whole of government approach, especially at the county levels, the county commissioners, emergency operations, and those folks, and then our public health. And then at the end of this, we'll come out of it a lot better, and we'll make it through.
General, can I ask you a question? So the Navajo Nation is great neighbors of ours. They also are very remote, and we've always had concerns about that they're getting the supplies they need and the help they need. Was the General McGuire, did he give you any update? Are they getting everything they need? Or is everything being adequate for the Navajo Nation?
Yes, as a matter of fact, he's shipping hundreds of guardsmen into that region. And also, it is working with Utah and New Mexico, because as you know, the Navajo Nation encompasses those 3 states. And so they've been working very hard. And then we've been working at the state level too with our Ute tribes. And so, and to make sure that the same thing that happened in the Navajo Nation does not happen with our Ute tribes. So yeah, I've been working very hard on doing that stuff. And I know, Mike, you've been doing that at the EOC level also. Yeah.
All right, thank you.
You bet.
So do we have any representation from the Guard here in our local tribe, our Ute Mountain Ute tribe here, or have they requested that, or can you speak to that at all?
Yeah, not that I know of right now. Originally, they had, the Ute Mountain tribes had requested a couple of planners, and then the state actually fulfilled that request, not with the National Guard. Could have been us, but they found an alternative to making sure that they were satisfied. So right now, I don't think there's any unmet needs.
Yeah, we don't have a National Guard presence with either the Southern Utes or the Ute Mountain Utes. They've made some requests, and then as we kind of work through them, we fill them with other assets. And of course, the biggest challenge for the Navajo Nation and for the Ute Mountain Utes and the Southern Utes is, they're stuck in the same challenge that the rest of us are with the supply chain and how rapidly they can get testing equipment or PPE. It's not better for them. They're short, and the same challenges we have filling Montezuma County, we have filling with the nation. So.
All right. Commissioners?
No, just very happy to have you,
Yes,
your
yes, we
assistance.
are.
Yeah.
So our agenda is been a little bit modified. We've got a meeting today, and we have several folks. In fact, I don't know how many's on there from what I can't even see, but we are actually going to be having a discussion about the topic that you had asked about the opening, and that's what we're going to be doing here fairly soon.
Yeah.
Thank you. We
Thank
really
you, Major
appreciate it.
General. Appreciate you. Yep. Travel safely.
Hey, my wife's seen you. Get pretty low when you get to that green house.
All right, take care. You bet. Thank you, guys.
What's he after?
Oh, okay. Gotcha.
Why don't I ask you a simple question, Shaq?
You just got a single answer, and it was very accurate.
So I got to tell you, if I do get the coronavirus and perish, you can let them know that I was one of the ones that had never used hand sanitizer. And that maybe you should use hand sanitizer. But so far, I have not used it once. What? No, I don't want to use it.
Ready?
All right, good afternoon, ladies and gentlemen. Hopefully everybody can hear us. Give me a thumbs up if you can hear.
Nice.
All right, thank you, ladies and gentlemen. The first thing that we're going to do is we are going to stand and we are going to say the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, everyone that has joined us today. This is kind of how we have the agenda. I don't know if you've seen it or not, but I'll give some opening remarks. We're going to start off with a presentation of business and public surveys that Susan Likey had. And that would be with the Dolores Chamber of Commerce, representing, I think they call them the tri-chambers now. They all work together. Is that correct, Commissioner Candelaria? Okay.
Password.
And then on our agenda, we'll have a discussion of the new guidance with the CAL, PHO recommendations, and then we'll have some comments from the municipalities, health department, hospital, chambers, and the public. Not necessarily in that order. And then we'll talk about recommendations and new approaches for how we move forward on Monday. So as you have been aware, Montezuma County has been working on a plan to reopen in a safe fashion, always in a safe fashion. That is one of our top priorities. We all had the opportunity to listen to the governor yesterday and his plan for the reopening of all of our state. And so listening to his plan, looking at our plan, I'm going to make the request that we take our plan and we shelve it and we adopt the governor's plan, and then we work with the governor's plan to improve it as far as how it would work best for Montezuma County. Our plan, looking at our plan, is a great plan, but it's also a plan that's going to take considerable amount of time to do. And I think that if we was just to use the plan from our great governor of Colorado and use his plan to open, then we could work on chipping away at his plan to modify it so that it would work for Montezuma County. With that being said, Commissioners, do you have any opinions about a discussion of having that today before we get on with the agenda?
Well, Commissioner Sukla, it's going to be a process, and it's obviously going to have to be a very measured process. I think we've got the science and the information in front of us is what's going on in our county. We've got outside of our county things that are going on as well that we have to be very cognizant of. We've got 3 other states that border us that are having greater issues with this COVID-19 than we are. And I think anything that we do here in Montezuma County that enhances or brings outside interests into our county, we've got to be very respectful of that, because there's some bad things going on outside our county as far as this disease goes. So I think I find I'm in close agreement with you on, yes, let's adopt what the governor has put down, what his next step is, his phase 1 movement. And then I think we start trying to then maneuver and manipulate that plan to hopefully fit Montezuma County a little bit better than just the great big statewide plan, that we kind of use some enhancements and maybe find some areas that we can do things a little bit differently, or maybe even enhance some of the things that the governor has allowed us to do. So I'm in agreement with you there.
Thank you, Commissioner. Commissioner Candelaria.
So after attending the Zoom couple meeting yesterday, Colorado Association of Local Public Officials, basically the roadmap that it sounds like they're going to give to the governor, and this is the roadmap that he's sending out, then I too agree that these are the guidelines that we really are going to be pushed to work with and to follow, and I think that's that's a good conversation today, so a work session, working with the hospital, with the local municipalities, Cortez, Dolores, Mancos, so that we can come to a collective, collaborative agreement between all of us, and then that's how we proceed as a county. So I agree, we can start working on that today also.
All right, thank you. We'll go back to the agenda. Thank you, Commissioners. We'll go back to the agenda, and we'll go to this presentation of the businesses and public surveys with Susan. Are you ready, Susan?
I'm ready, thank you.
Thank you, and good afternoon, Susan, and thank you for all the hard work you're doing. You and the other chamber chairmans as well.
Thank you, Commissioners. So this survey just went, hold on, I'm getting, okay, so this survey just went out recently, and we've had, it's a two-part survey. So the first part went out to businesses specifically to try to get information on what their worries and what their needs are to be able to reopen. And then the second part was a public opinion survey on how comfortable they felt visiting businesses and what their thoughts were on that. So Shaq did put up on the screen, if you would like to follow and you don't have access to looking at his screen, you can get access to the survey by going to visitdolores.com. There's a drop-down menu under COVID resources that says Public Survey and Business Survey that you can click on. We had some surprising results, but I wanted to go over a few of the things. First of all, people responding for businesses. 53% of the businesses had storefronts that responded, and 37% of them are currently closed. 30% are currently open, and that's probably reflective of the essential businesses in here. Going down a little bit further, we asked a question, if your business is closed, what do you still need to reopen? And the response, the biggest response was, I don't need anything to reopen. So there are some businesses that are ready to open. But there are some that said, their biggest thing is restocking their inventory or their supplies, and being able to have the proper disinfectants to be able to open and run their business. The next one was, when would you feel comfortable reopening? 33% of the businesses that responded said immediately. And then another 35% said when testing is available, and another few said when they get the okay from the health department. These were multiple, so they could answer more than one question also. And then 20% said that when they have their own plan in place, that they would be comfortable reopening. With the next graph, we asked the question, are you worried about liability in opening back up should somebody get sick? 48% said no, 34% said yes, and 16% said that they were unsure with that. The next one is, what do you think is part of a sensible business reopening plan? We asked about barriers, limiting people, personal protective equipment, sanitation plans, signage, and other. The biggest one, of course, was the sanitation, having a sanitation plan. I think a lot of the businesses are very concerned to make sure that they're protecting both their employees and the public. And then limiting the number of people, was 65% of them said limiting the number of people was important. Is a sensible business reopening plan. The last graph on this list is, at what operating capacity would it make sense for you to reopen? The majority said that they were unsure. 28% of the businesses said that they were unsure on what operating capacity it would take in order for them to decide whether or not they wanted to reopen. 21% of the respondents, though, said they wouldn't reopen until closer to 100% operating capacity. When they were allowed to open at full capacity, would they want to reopen? 9% said at between 50 and 75%, and then 20% of the businesses said that they could reopen at 50% capacity. And then we've got some lower things in there. Below that graph, I did load up everybody's comments for businesses. We asked them two open-ended questions. One were, what are your worries about reopening? And then, have you changed your business model, or will you change your business model to react to the current conditions with businesses? So there are quite a lot, and if you have a chance, go on to visitdolores.com, and you can take a look at all the different comments that came in with that. The other survey that we did was the public survey. So Shaq, if you could go to that tab. We had 315 respondents so far. The majority, I'd say half of them, came from the zip code for Cortez, and another few from Dolores, and Mancos was probably split half and half with their respondents, the other part. So the first graph is, do you follow any businesses on social media? This was actually surprising, where 86% of the respondents said that yes, they do follow some businesses on social media, and that will affect what we put in our toolkit that I'll be talking about later. Next one is, are you wearing a face mask when you go out in public? 70% of the respondents said yes, they are wearing a face mask. 15% said no, and 16% said sometimes. And we had a few people respond that they don't visit businesses, so it was not applicable to them. Next graph is what things would make you feel safe shopping at local businesses right now, and they could check all that apply to them. The biggest response from the public said that they want to see a sanitation plan in effect with 76%, and then the next highest one was limiting the number of customers at 66%. After that, it was personal protective equipment of the employees, which was at 63%. And then everything else, like rapid testing, was at 52%, health regulations in at 46%, business plan in at 53%, and social distancing in at 50%. With the next graph, would you attend a public event of 50 or more people this summer? Check all that apply. This was kind of help us to determine how the special events and tourism season would start unfolding this summer. 45% of them said that they were unsure, maybe, that they would try to attend an event, maybe not. 29% said absolutely not, that they would not be attending any events this summer. 18% that they said that they would attend an event in June, 14% in July, 12% in August, and 12% in September. So you see the numbers are pretty low with people that are willing to attend some events this summer. The next question is, after restrictions get lifted, on average, how much do you plan on staying at home this summer? 29% of them said that the majority of their time, up to 100%, will still be remained at home. 28% of the respondents said between 50 and 75% of their time they will be remaining at home. 20% said between a quarter and a half of their time will be remaining at home. And then 14% said just a quarter of their time would be remaining at home. The next question was, do you believe in a phased approach to reopening will be effective? And 43% of the respondents said yes, a phased approach would be effective. 21% said no, and 34% were unsure. The next question we asked was, do you feel social distancing measures currently in place at essential businesses are effective? 51% said yes, 25% said no, and then 22% said that they were unsure. With the next question, if COVID-19 antibody testing were available, would you get tested? This was another surprising result, where 66% of the respondents replied yes. And I should have added the caveat to that, saying you had to have been sick in order to be tested for antibodies. So the fact that 66% of them responded yes, I don't think that most of them were sick, so that might be a skewed result there. But 17% said no, and 15% said that they were unsure. During this pandemic, how have you done the majority of your shopping? Check all that apply. 83% of them said that they were still visiting businesses, and those were the essential businesses out there. 46% said that they did their shopping to non-local online outfits like Amazon and Wayfair and things like that. 25% said that they were able to find a local business that had an online store and were able to shop online through them. and 46% said that they were doing curbside and pickup services. The next question was to kind of gauge, again, tourism and vacations this summer. So we asked people, are you planning a vacation this summer, and check all that apply. 45% of the respondents said no, they're not going to be planning any vacations this summer. 17% said that they were going to be doing some day trips. 13% said that they would be planning a trip within a 4-hour drive. 21% said that they would be planning a trip within an 8-hour drive. Only 12% said that they would be getting on a domestic flight this summer, and 2% said that they would be on an international flight this summer. So that means that most of people that will be visiting this summer will probably be a drive-through market. And then the last one on this list, we asked what types of businesses or services will you not be afraid to visit once the restrictions get lifted? Check all that apply. So there's a lot of different types of businesses we listed in here, as well as some other things. The biggest one was outdoor recreation. They would not be afraid to be doing outdoor recreation, including hiking, biking, rafting, boating, things like that. 78% said that they would do outdoor rec. The next highest one was 63%, which is national parks, and then 62% was city parks. So a lot of the outdoor stuff was the highest responding, as well as 62% of respondents said that they wouldn't be afraid with visiting their doctor once restrictions get lifted.
Hey, Susan?
Some of the lowest ones, so retail shops was at 44% of the people said that they would visit a retail shop, 38% said restaurants, 26% said the gym.
Commissioner Ertel has a question.
Sure.
Susan, can you hear me? Susan, can you hear me?
I can barely hear you, yes.
Okay. My question is, you've got outdoor recreation at a very, very high percentage, 78%. Don't you feel like golf should be included in that outdoor recreation and not in a category by itself? Because a lot of people don't play golf, but it is certainly an outdoor recreation. I think it should be categorized along with your outdoor recreation, which is a very, very high percentage.
That is true. Another one, we had a low response for clubs as well, and so we don't have really a lot of clubs around here, but I wanted to not limit it to respondents from just the zip code, so I did add some things in there. We wanted to see particularly if people were amenable to the golf courses opening, so I did add that as a separate, but it is considered an outdoor recreation thing, so. Let me continue on. The lowest ones did seem to be indoor events, so like clubs, indoor events of 50 or more people were only at 18%. Going to the casino or to the theater were pretty low as well. So that's really it for that part. And then, again, there's a lot of different comments. With 315 respondents, there were a lot of comments on both sides with that. So, again, if you have a chance, please read through them.
Okay.
All right.
Are there any other questions on the surveys, commissioners?
Any surveys, commissioners?
No.
I don't think I have any, Susan. I think I asked most of my questions earlier, which are mostly in these remarks on the survey at the MBT meeting. So, no, I don't.
Thank you, Susan, and the other two chambers for helping put this information together. It's very helpful with the plan that Montezuma County will be moving on as we move forward.
We do have the survey still open through the weekend, so if you have not completed the survey yet, please get online and complete that. And we'll be publishing that and giving that out to businesses early next week.
All right, thank you, Susan. Next on the agenda, ladies and gentlemen, we're going to do a discussion of the guidance of CalPO recommendations. So I'm not sure who's going to lead that. This is.
I think that, I don't know if the hospital's on here, or the municipalities on here also.
The
Cortez.
municipalities are on, the hospital's on, the health department's on, and a whole bunch of people from the public are waiting on the phone.
Okay, so I think we can start by looking at the first 5 steps. I don't know if you can pull that up or not, Shaq, but what we have to do. So, Tony, if you want to chime in on this one as far as the 14 days of decrease in cases. I know yesterday we had 2 more cases arise, but if we go by that, you know, we're never going to get out of this, because we could get a new case tomorrow and so on and so on and so on.
14 days goes on forever.
And as we start testing, the cases are going to rise. So, Tony, if you can put some input on that of how you think that works as far as the hospital, and then Dr. Aiken from Public Health or Bobby from Public Health, what are your thoughts on just getting past step 1 of the five phases?
No, I think you're absolutely right. If you're looking at strictly the number of cases, and like you said, we would have been in pretty good shape up until yesterday, but with the 2 additional cases, we're basically at a new starting point. So, and yes, honestly, with the increase in testing that we hope to do, we're going to see more cases positively identified. So it's going to take a while to get beyond that true measure. So I think we have to, again, look a little bit beyond that and focus more on how are you approaching those particular identified positive cases. Are you able to isolate and identify, properly trace, and I think gain some comfort for that, and possibly when that happens, you're able to move beyond strictly just the numbers and looking at the percentages, and know that you have a sustainable process in place that would allow us to move beyond that.
Thank you.
So one question I have for you then, Tony, are those cases, and obviously if you can't answer, don't answer, but 2 is our hospital ready to handle, you know, what is the number there? Is it 20 cases? Is it 30 cases? Is it 10 cases adequately? You know, as these cases arise, are they hospitalized right now, or are they back home just with the stay-at-home orders?
Gosh, I'm trying to think if I can actually answer that or not. Obviously, the evaluation is going to be the level of severity of the cases also. And like you said, do they get hospitalized? You know, they're hospitalized, or they're utilizing a vent. And obviously, our vent capabilities are a little bit limited. So, yes, it goes beyond just the identified of the positive. What's the level of the severity of the illness of the positive? And what are our capabilities to handle, you know, as they progress within that illness? And if Dr. Aiken's on, I certainly will let him address that too.
Yeah, you don't need to mute your thing. Excuse me, we'll get rid of the echo. Hi.
Dr. Aiken?
Yes,
That's on his side, not ours.
can you mute yours, Bobby? Can you still hear me? Okay, can you hear me now?
Yeah, you're good.
Okay, great. Yeah, so the slide that's up there now kind of talks about some of the different things that we need to look at. Of course, that was also on the previous criteria, but you know, at this point, as Mr. Suddeth said, we are at sort of a new starting point. Yesterday represent the beginning of an outbreak, and we need a little bit of time to determine that. And I agree also that we don't want to use that as the only criteria. If we have adequate testing capacity, and also if we have adequate contact tracing capacity, then we can use the testing and the contact tracing to identify who in the community has the illness and try to isolate those people from the rest of the community, and particularly try to protect people that are high risk who might be exposed to individuals with the illness. You know, the capacity of the hospital fluctuates depending on the severity of the cases that are in the hospital. If we have many people who are quite ill and requiring very intensive management, that pulls a lot of the staff and the resources away and makes it harder to manage a lot of people who may have a less severe illness. And we also need to keep in mind that there are other illnesses in the community that we routinely take care of, and that we still want to have some ability to take care of. It's not fair to have somebody die of a heart attack or pneumonia unrelated to COVID, or have a real problem with some other chronic medical illness that we can't take care of because we're so overwhelmed with COVID-19 patients. Other questions?
Okay, I think, looking at the numbers, and obviously I understand that there are other emergencies that are going to come up through this. So, in your opinion, looking at this roadmap, can we move past step 1 to step 2 with the hospitals, in your opinion, as the public health?
For item number 3, the testing in particular.
No, I'm just talking about item 1. Because
item 1.
Because of the cases in the last 14 days, obviously, can we move there to item 2 and then 3, 4, and down the line? So my question is, can we move past number 1? I think, depending on what you just said, I think we can. Is that correct? Or
I think that within the next few days, we should know if we can move past number 1. There are a number of people whose tests, I understand, are still outstanding. If those come back negative and we're not seeing a sudden rapid increase, then I think we could move past number 1. If over the next several days we find that all of a sudden we're getting many positive tests, which would be quite unusual for us based on our experience since we started testing, then we'd have to reevaluate that. But it's safe at this point from the standpoint of planning to move past 1 with the understanding that we need a few more days to be sure about that.
Okay, thank you.
Mr. Candelario, I'd like to ask Dr. Aiken a question. Can you hear me, Dr. Aiken?
No, I didn't hear that.
Okay, this Commissioner Ertel. I saw today that there are some hospitals, and I believe they're within the state of Colorado, but there are several places that hospitals are now going back to elective procedures, that they're not being overwhelmed by COVID-19 patients. They've got plenty of staff and plenty of facilities to go back to elective procedures. Has our hospital talked about or considered moving back into some elective procedures? Because I know therein lies the revenue source for our. I know this is being very difficult on our hospital financially. And has there been any talk about moving back into doing some elective procedures at our hospital?
Yes, we have, and Mr. Seth can also address this, but we feel that because we are starting to have some increased available testing, and particularly because we're seeing some quicker turnaround from the reference labs that we send the test to, that we can incorporate a testing plan in being able to determine whether or not a person who might need these elective surgeries could be safe to have that from the perspective of COVID-19 disease. So we are working on that plan and soon hope to return to doing elective surgeries. And Mr. Sarath may wish to comment on that as well.
Kent, just for your information, I'm sorry, it just came to my mind. It was all of the hospitals in Mesa County. That's where I saw it this morning, was on KREX. Their newscast this morning, they had a spokesman, and all the hospitals in Mesa County are now open back up to elective procedures within Mesa County.
Yeah, that's true. And Mercy announced earlier this week that they're starting to resume their elective surgeries. Animas Surgery Center is going to do the same. We're on target for probably, I'm not sure we'll be back open next week, but hopefully by the week after, we'll be in a position to start to do that under very specific guidelines. And like Dr. Aiken said, we're adding a testing mechanism into that to, again, for the protection of our staff, to make sure we're not bringing COVID patients in to surgery. But, we're going to be down about 50% on our revenue this month. So it has definitely been a pretty major economic business also. So we understand what a lot of the community is going through.
Thank you.
Any more questions?
Not on 1.
Okay, move on, because you got the floor.
Okay. On number 2, Dr. Aiken and Tony, for the hospitalizations, looking at your numbers just on that past slide. So what do you have a number, Tony, that you would just designate for this now? And obviously, I realize this is going to change depending on testing and what kind of an influx that we get or we don't get. But is there like a number of beds that you would commit to just that right now? Because we haven't, obviously in this area, geographically seen that spike that other counties or cities have.
I don't know that it's going to be on specifically on a number. Shaq, I think that one may be on your all's end. As I was saying, I don't think it's going to specifically be a number. It's going to depend a lot on the severity of the type of patients that get admitted. We'll have capacity up to, I believe, almost 60 beds in-house to take care of patients, but we're obviously a lot fewer than on ICU, and our vent capabilities, I believe, are at 7. I think that's the number of vents that we have available. So again, it'll depend a lot, not just on a number of patients, but on the severity and the type of patients that we get in.
Yeah, it's really important to understand that the intensity of care that a particular patient may require, whether it's for COVID-19 illness or some other illness, really has a big determination on how well our staff can cope.
Right, and I understand that, and that makes perfect sense. So here's my next question for item number 2. Do you gentlemen feel comfortable as public health and SHS, our hospital, are we okay with item number 2 of our roadmap, our Colorado roadmap?
We lost audio.
All audio or?
We can't hear Dr. Aiken right now. Hang on a second. Bear with us a second.
Well, I think the question's easy answer. If you have 0 COVID patients, the answer would be yes.
And 11 of the 15 that we have had are recuperative and well. So yeah, I think that number 2 is a no-brainer.
Hang on, IT's jumping in.
We're going to have to speed up, gentlemen. This is taking a long time. We've got a lot of people
Yeah.
wanting to weigh in.
We can't hear Dr. Aiken speaking, is that what you said?
Yeah, that's what I'm
Check.
saying. IT is messing with the computer now to get it back.
So they can
It looks like he's talking, but
No, it's on our end.
Can hear you. I think Shaq's working on that.
I can hear
Okay,
Kim.
thank you.
Okay, I think we're good.
Okay. You want to
Okay,
reiterate your question, Dr. Aiken, Jim?
sorry, Dr. Aiken, but basically I think what we were asking, or I was asking, is that it seems like we're safe to say with what we have vacant in the hospital that that number 2 out of the roadmap, we're pretty much okay with that at this present time.
Yes, at this point we are.
Okay.
We just need to remain flexible.
Okay.
Absolutely.
Number 3.
Okay, number 3 on the roadmap, the testing, and I know that you had mentioned the Abbott machine, which is not the machine that we've ordered from BD Max, but it is a opportunity for testing. to get within that 24 hours, 12 to 24 hours. And the roadmap states that we have to be working towards the testing, which I definitely think we are.
Yeah.
We just don't have the for sure drop dead date when the BD Max is going to be here. Would you agree with that?
I would say right now that we are, it's very precarious as to whether or not we have enough testing. We do have a few rapid tests available now in the hospital with the Abbott machine that arrived from the state earlier this week. They only sent 4 dozen test kits, and we could go through those pretty quickly. We are working to try to allocate our use of all forms of testing that we have. In other words, people who don't immediately need to be in the hospital would be tested using one of the send-away tests that are available either from Cedar Diagnostics or at our drive-through. And right now, the turnaround time on those has been fairly quick, but I would not say that we could guarantee a 24 to 48 hour turnaround. We would hope to have more rapid tests. The BD Max is one big source of that there should be an allocation meeting by that company in the next few days. And if we are allocated one of those machines this time around, I would expect that it could be functional in our laboratory within 7 to 10 days, assuming that they send us enough kits to be able to use. So, as I say, we're in a precarious position right now. We have several plans in place to make the maximum utilization of the tests that we have. And as an eternal optimist, I would like to say that we're on the cusp of being in a much better position within the next week or two.
Okay. And then item number 4, I think, Bobby, you stated yesterday on the live Facebook with Southwest Health System, and correct me if I'm wrong, but we're getting our contact tracing done relatively quickly now. Is that correct?
Bobby had to step away to another meeting, and I think I can answer that for her. She's actually meeting right now with her nursing staff in regard to contact tracing. What we've seen over the course of the last month or so, as all these different cases have been identified, is that we are immediately notified of a positive result. As soon as that result returns from the lab, Bobby becomes aware of that and immediately goes into action to try to contact the patient, to determine the patient's condition, to give the patient care advice as to how to take care of themselves, to make sure that that person is self-isolating, and then to begin the process of identifying who that person has come in contact with, either in the household or elsewhere. At first, when we only had one case or so a day, that was a fairly easy process for the staff to manage, although Bobby and others have been on call very frequently because many of these calls from the lab come back in the middle of the night, and I can attest to that. I've gotten some of those. And yet yesterday, when we had 2 cases and determined that there were other household members who might also have the illness, it became a pretty significant task to try to start to figure out who these people may have been in contact with. As far as we can tell, they've been very well isolated, but that process is still taking place for these 2 new cases to identify, who else we need to be looking at as potential sources of the infection throughout the community, and that's a really important part of item number 4. So hopefully, Bobby and the health department in general, with the support of the county, will be able to ramp up this ability for contact tracing. We may need to get some additional trained people to help with that, particularly if we would start to see an increase in the number of cases frequently. So I think that's another thing that we need to have this as part of the plan as we move forward. We have some capacity for item number 4, but the support to get additional people on board so that they can share the load of this and have enough people to start to identify these cases quickly is going to be really important.
Okay. And then number 5 on the roadmap, which I'm going to say we've been doing that almost since day one, you know, talking about older adults, age 60 and older, underlying medical conditions, you know, if you're at risk, you know, please stay home, don't come out, don't come shopping, so on and so forth. I think item number 5, we're basically doing right now, and we've hit every bullet point on that. Would you agree?
Yeah, I think that survey was really neat. I was glad to see that 70% of the people responded as they were wearing masks, and I think that's probably consistent with what we see as we go out to the grocery or other places. I've certainly gone out to do a shopping trip as well as pay attention to what's going on. As we increase the ability for businesses to reopen and people to start to engage more with different activities in their life, again, it's a matter of emphasizing the responsibility that each of us has to follow these guidelines. And I think we have good guidelines, and we are working to make those clearer and clearer. Again, the survey indicated to me that maybe some people, at least in businesses, would like to have some even clearer guidelines for what's going on, and I think that's part of this overall plan.
Okay. So I think I've hit everything on the roadmap, Commissioner Sukla, on the first page. If you want to open it up to something else before we hit the rest of these, or however you want to address it.
I guess you brought this to the table, Jim. This I said on this call as well. Yesterday it was a webinar, and these are recommendations that have not been adopted by the governor. If I'm correct.
No, these are just recommendations.
Right. So
right now.
I really feel like what the meeting today is about is this is a plan, a working document that will be continually be worked on and changed and modified as the situation every day might be different on how our plan is changed. But I think that what we are here today is Monday's not very far away. And what we're trying to do is we're trying to figure out, are we going to adopt the governor's guidelines, which he has not even put out yet.
No, tomorrow afternoon, I believe, right?
So we need to make a decision about adopting those guidelines so that our businesses know if that fall into the guidelines that can open up a soft opening, that they know that they can do that on Monday. And so the sooner that they know that would be better than later.
So I think what Shaq has just posted here is kind of what the government or the governor's recommendations are going to be. Is that what you're showing?
Yes, this is from Governor Polis.
So that actually is all of page 2. What is there? So if that's what you're wanting to go over, then we need to go over page 2, which is the Green Circle initiative. So I think I'll just leave it at that. But page 2 of that is basically everything that is outlined from the governor.
Okay.
So again, I'm in agreement with the governor. I'm in agreement with the governor's recommendations, and I don't think I would need to go through, as a commissioner myself, would need to go through every one of these when I'm in agreement with the governor's plan at this point.
Okay. Yeah, I've gone through this list a number of times, and I agree with everything that he's got on his list here. I do have some other things. I think there's a couple of more selective things that I think we'll look at as we approach Monday that are going to be a little bit more specific. But overall, what he has put down here is a very good start to a phased opening and getting back to some kind of economic activity in our community. And I think that's crucial at this stage, that we start seeing how these businesses and people that are in our community can work within these guidelines, be as safe as possible, keep everybody that comes to that business as safe as possible, and start to regenerate some economic activity in our community. And I think the governor has allowed us to do that. I think Governor Polis has allowed us to begin that process. And I'm grateful for that.
Good. I agree. These are all on page 2 or 3 or whatever it is.
And I just as a rebuff, we went through those 5 steps there, the CALFO 5 steps there. And we are okay or greater than. There's only one that we're deficient on, and that's number 4. So 4 out of the 5, we are already there with what CALFO is recommending for us to be in a substantial way ready to enter into this new phase of, not the stay-at-home, but the closer to home steps, the 65 to 60 to 65% of things.
Correct.
So-
And I just wanted to make sure that, I was getting that communication with
Right.
the hospital
Oh, yeah.
and
No,
the public health. And I know that the
Absolutely.
municipalities are also out there listening. So, and I
Absolutely.
agree. We were just a little deficient on number 4, but
Yeah.
there
Yeah.
again, that's going to become better with more training and more people within that health department, which I think Bobby stated
Yeah.
last meeting that they did hire a new personnel, so hopefully
Yeah.
they'll be getting trained
Yeah.
relatively quickly. So
Yeah, and that
we
contact-
should be up, we
Yeah.
should be up to speed very quickly.
Yep. Okay.
Okay.
Would that be the end of the discussion then on Cal?
That's all I have.
Calpol? All right. Shaq, you're probably going to have to do it from your end, but we can.
They can hear you now. I fixed the
Oh.
mic.
He
Okay.
pushed
Things are
us
getting
over
better.
there.
So I guess we can open up a discussion with, or some comments from our municipalities. I guess we'll start with our largest one. Is there anybody here representing Cortez, and if they would like to speak about moving forward on opening up on Monday? I can see the moon, but I don't see John.
Yeah, see the comment going by.
Okay, well, since John's not there at this point, let's go to, is there anybody with, I see Chad Dolores. Would you like to comment on opening up the county on Monday as the governor, with the governor's plan?
Sure. I hope folks can hear me. This is Chad Wheeler, Mayor and Dolores. Ken couldn't be with me today. I just say briefly, number one, I applaud the commissioners for doing their due diligence and sort of accepting what the governor put out as far as the safer at home phase. It seems like a lot of thought went into that from the state level. And I think that makes it easier for us as a municipality to get the message out to our citizens, our businesses, all our stakeholders on what kind of guidelines they can expect and look for. And I guess one last thing that I would say is that one thing that seems to be coming through pretty clearly is that businesses and individuals are just going to feel a whole lot safer when we have ample testing. And I know the hospital and the healthcare providers are doing everything they can to get that in place. And I would certainly hope that the county and municipalities as well would be doing everything they can to help them in that aspect. And then lastly, I just think that one of the most important things that we can do as both county and municipalities is messaging. And that is helping our citizens understand what the guidelines are, whether they are individuals or businesses, around what the state's putting out, asking people to please wear masks when they go out, helping them understand that masks really, I think, are important for your community, not so much for protecting yourself. We're doing that for each other. And then secondly, about abiding by the distancing guidelines that are out there. Anyway, that's kind of where we stand as Dolores.
Well, thank you,
Thank
Mr.
you.
Wheeler. On behalf of the commissioners, we appreciate your input. Very good input, by the way. Thank you, sir. We'll go to Heather from Mancos, for Mancos Town Administrator.
Hi. I just want to say thank you. We definitely agree with the comments that were made today by everybody. I'd specifically like to thank the Tri-City Chambers for the work that they've done. The survey results are amazing, and they're going to be very helpful to us during the planning process from an economic recovery side. At this time, Mancos feels that we should follow the current governor's guidelines. It will give us time to continue working together. All of us can continue working together to draft a plan specific to Montezuma County for reopening when we do have testing that's more widely available. Those are our thoughts on it. And regardless of what happens, we'll continue to promote the safety precautions masking, social distancing, personal responsibility, those are ultimately what we have to continue doing no matter which direction we go in. So, but I do want to thank everybody for their comments today.
All right. Thank you, Heather. We appreciate that. How about Mr. Dowdy? Is he, for representing the city of Cortez, is he back yet?
Your district, shut the building down empty, so that's not a problem. Well, your damn foot was down. Well, mouth to mouth, I think, 46 foot.
Is that his?
John, are you there?
John Doherty, can you hear us?
6 feet, 8 feet.
John Doherty.
He keeps wearing a mask all the time.
I think he's talking to somebody else.
All right. Well, why don't we mute him? But I will I will put in a shot of this, and I think both commissioners. But if you are listening, we have a lot of constituents who want to know when you're going to open that golf course. And looking at the guidelines, it is feasible to be open, and so we would like for the city to let us know, because us commissioners that have no authority over the golf course are getting pounded by people wanting to get out there. And I got to tell you, I support those people wanting to use that golf course. I know a lot of those people that use it, and they're on the verge of a heart attack, some of them every day. And that exercise they get out there on that 200 acres, that sunshine that they get, is very well worth it. And I, as a commissioner, I think it wasn't a wise decision to close in the first place. So I hope you could rectify and change that decision.
Commissioner Sukla, I think I might be able to help you with that. I have heard Mr. Doherty state that I think it comes before council on the 27th. They'll make a vote, and the golf course, they're planning to open it on the 4th of May. So they are planning on opening the golf course back up. So
Okay.
that's
All right.
good news.
And I would echo that. In a meeting that we had, I think it was, I don't even know when.
I can't remember, one of the
Here-
Zoom meetings we
Here,
were
one
in.
of these recent meetings, he is bringing that back up to council on their next
council
Tuesday.
meeting. Yeah.
Or whenever it is.
Yes, this is Karen Sheik, and I can tell you that it's on the agenda. It's on the agenda for Tuesday.
Okay. Thank you, Karen.
They just recently have gotten the things in place that they need to have in place in order for folks to go out there and safely sign in and pay. So we're not too far off the mark here on this and getting it reopened.
All right. Thank you, Karen. We appreciate that. Gentlemen, on the agenda, I don't know if I think Bobby said it's left. Is anybody from the chambers, do you have anything before we open it up to public comment?
Yes, I do. This is Susan with the Dolores Chamber, and I'm representing the Tri-Chambers as well as the Montezuma Business Task Force that we've created. One of the things that we wanted to do as a chamber was help the businesses get the information they need in one cohesive packet. So we're working on a toolkit to give out to businesses. We should have that hopefully done by this Sunday, depending on the information that we get from the governor's office. But it will include the state and health department guidelines on reopening dates, sanitation, what they need to do with their employees, social distancing and everything. But it will also include some signage that they can put out and display with information about what to do when they come into their store and what practices they're adhering to. We're also going to include the business and public survey information along with an online checkup toolkit. So we want to make sure that businesses are also making sure they update their hours on Facebook, TripAdvisor, things like that as they move forward to opening. And if they have a website, making sure that they update their information there. We're also including information on links, so how to sign up for our newsletters, how to get to SWCODA, the SWCODA website, Region 9, Small Business Development Center, the chambers, the Facebook groups that we have, and along with some nonprofits and some hospital information. It will also include some, if a business does not have an online presence, we can also help with that. So it will include information on how to get connected with people who can help them build a website or Facebook pages or things like that.
All right. Thank you, Susan. We appreciate that. As we move forward with this, ladies and gentlemen, we're going to have, there's a bunch of people on here that would like to comment. And I think we're going to have to turn that over to the county administrator, Shaq Powers. I think we're in agreement, except for getting, maybe Karen, you can answer to this. I think this meeting today, there is an agreement, at least with 2 of the 3 municipalities, that the governor's orders will be followed on the opening, and that as soon as those guidelines have been put in place, the governor releases those guidelines, then we will be able to get that out with our PIOs as quick as possible, so businesses, neighbors, everybody knows how that's going to work out. And if you had watched the governor's meeting yesterday, if you don't want to open your business, you don't have to.
You don't have to.
If you
That's
don't
right.
want to go to town, you don't have to.
You can stay at home. You
Stay
can,
at
you
home.
can
So
keep it
if
just the way you want it.
If you are, and as well as our critical, our people that are in the position that are more in line of not of perishing, please stay home. And the guidance from the governor was that all of our nursing homes and everything will just stay according to they have in April and May as well. So with that being said, could you open up, Shaq, for comment?
So what I'm going to do is I will just go down the list of names that I don't recognize. I will unmute them, give them the opportunity to say what's on their mind. You may choose to respond or not to respond, and then I'll go to whoever's next. Is that agreeable for everybody?
Yes, except Commissioner Candelaria would like to.
One second, I just got off the phone with Congressman Tipton. He said that he will start following back up. I just asked our attorney for the TV stations for local news down here from Denver, and he will also get with Bennett's office, and then we'll start moving that as rapidly as possible. So, thank you.
Okay. Thank you.
Okay, the first person I have alphabetically is Angie Hunt Baker. I'm going to unmute you now. Angie, can you say something so we know you're there?
I'm here.
Okay, go ahead and tell the commissioners anything that's on your mind if you have something to say.
I'm just listening, and I don't have any questions right now. Thank you.
Thank you.
Thank you.
Thank you.
Next, I have Bryce Tanner. It's not Bryce Tanner. If you're there, you're unmuted. Anything you want to say to the commissioners?
No comment at this time. Just getting information.
Thank you, Bryce. Next, I have somebody named Kathy. Kathy, you're unmuted if you'd like to speak at this time.
Just listening, thank you.
Next, I have Colton Black. Colton, is there anything that you'd like to say to the commissioners?
Yeah, I just wanted to talk real quick and just remind or, kind of bring up, I think that, I understand that people have worries and concerns about the virus, but I believe it's time community leaders and local officials quit ignoring the serious health and safety risks that the shutdown itself imposes on people. It's not just about dollars in our economy. There are increased rates of drug abuse, alcohol abuse, child abuse, domestic violence, food insecurity, suicide. All those things are things that, were problems in our community before this pandemic hit, and those things don't still go away, and in fact are probably being quite a bit exacerbated by the shutdown, and the longer it continues on, the longer those effects are going to be felt from that. And I think that there's a good chance that locally the death toll from those kinds of things may actually exceed what our death toll from the virus is. So I just want to put that out there, that I hope that our community leaders are weighing that in their decisions on whether or not to reopen things, and understand that the longer we take to reopen things and get things back to normal, the more impact that we're going to be felt in that side of the equation. I know that's not what's in the news and not what is at the forefront of everybody's mind, but there is a lot of, young and vulnerable people out there that don't have a voice in this, and, they're not going to school, they're not being seen by teachers or other folks that can, relay their concerns or what's going on in their lives, and they need to be part of the decisions that are being made. And then, we had a suicide epidemic before all this began, and, as people lose their livelihoods and struggle to find, ways to support their family and put food on the table, and, Depression is a real thing, where people are isolated and not able to socialize. All those things have an impact, and I think we need to be, looking at the broader picture of all of this and making sure we're considering that. And I don't think opening things up is going to change much. We talked about hot spots of, populations that nearby that, traveling to our area to shop. Those people are still coming here. Walmart is still open, and they're, selling stuff that, our local businesses could be selling and using that revenue to survive. I work for a local bank, and we, recently put $5 million out in the community through, that payroll protection program, for businesses to put employees back to work. That money has a time limit on it. It starts an 8-week clock. They have 8 weeks to spend that money. So those employers are having to bring those folks back on and start, getting them working. And if they don't have customers to serve, they're paying employees that they're not really able to make good use of. Yet a lot of those dollars that those employees make, as well as, stimulus checks that have started to hit bank accounts, we're allowing those dollars to flow directly into, the bank accounts of Walmart and Kroger and, other large corporations and not our local businesses. And so I think that all of those factors need to be being made part of this discussion a little bit better than what I've seen so far, and I really hope that we can do that. So
All right, thank
I
you.
appreciate your time.
We really appreciate it, and I can tell you that your county commissioners, I can speak for them, all of those concerns you have are at the top for us as well. We are very well aware of the things that you had talked about, and so that's why we're having this meeting today, exactly, one of the reasons. So thank you. Who do you have next?
Mr. Black, this is Dr. Aiken. I would like to thank you. You expressed that really well, and I want to echo what the commissioners have just said, that it is in our minds, and we understand that getting some things going again can make a big impact on that. So thank you for putting that out there. That was really well said.
Okay, next I have Diane. Diane, is there anything that you would like to say to the commissioners?
No, thank you. I'm just listening. Thanks.
Thank you, Diane. Let's see, Heather Alvarez. Next I have Henry. Henry, is there anything that you would like to say to the commissioners?
No, not at this time.
Thank you. Next I have Jay Balfour. Chief Balfour, is there anything that you would like to say to the commissioners at this time?
Is he muted? Is Henry?
I lost somebody there. Colton.
The only bad thing about this.
Yeah, it's very difficult to do this. Kim Purcell, Christy Hall.
No,
Next
I'm
I
ready
have
for your
Christy Hall. Christy Hall, is there anything that you would like to say to the commissioners?
No, we'll just listen and thank you.
Well, I did see that we had the Cortez City Manager there, but I think one of the most important things to know is, and he's gone again, but the most important thing to know is that we are going to be abiding by the guidelines from the governor so that the businesses are aware of that on Monday. So if the city's position is different,
We need to know that.
we need to know that, and or your constituent in the city of Cortez need to know that.
Absolutely.
Do you have any other?
Yes. Let's see, next I'll go to Jesse's iPhone. Jesse?
I didn't think I moved up that high.
Jesse, do you have anything you'd like to say to the commissioners? Jesse's iPhone. No for Jesse's iPhone. KS, I don't know who KS is, but KS, you may speak if you would like to.
No, just listening. Thank you.
Yep. I think it's very important that the city of Cortez, the biggest municipality, weighs in.
Yeah.
If there's anybody that's at the city or can get a hold of the city manager, Monday is not very far away, and these people need to plan on the soft opening. So it would sure be good to get here he is. John, could
Go
you
ahead,
address? I don't know if you've been hearing, but could you address, is the city on board with the recommendations of the governor for a soft opening? The floor is yours, Manager.
You're unmuted. Go ahead.
I believe so. It hasn't been run by the council, but, it sounds like a solid plan if we're gonna be opening.
Okay.
And I think I've already discussed with you guys, I'm taking it to the council Tuesday night, to open up City Hall and the service center, and then have curbside at the library, and then on May 1st, open up the golf course. I'm starting to get counter, from the golfers. Now it's the other side saying, don't open the golf course, but I'm gonna be taking it to council, and I think we got a good plan to keep people apart and not to reach into the cups, and keep the social distancing going. And we've told the manager out there he needs to keep a close eye on them, because if it's not done, then we'll have to shut it back down. But I'm sure they're aware of that, and they'll be paying attention.
Well, that's all good news. We really appreciate the comments and look forward to what happens on Tuesday. But it looks like on Monday, your businesses will be opening up that are allowed to.
Sounds good. I need a haircut.
Yeah.
Thank you, John.
All right. Thank you, City Manager. Shaq?
Next, we go to Margaret Goodell. Margaret, do you have anything?
No.
Thank you, Margaret.
We like your background, Margaret. I can tell you that.
Let's see. Next, we go to Robin Ricard. Robin, would you like to address the commissioners?
I would. Can you hear me?
Yes.
This is Robin Richard, and for those of you who don't know me, I'm coming from the perspective of a small business owner and a physician who has been taking care of a high-risk population in Montezuma County for 15 years. I do have some comments. First, I appreciate the need to have a phased reopening, and I appreciate the county and the local municipalities for putting some serious thought into this. Have a lot of gratitude for Southwest Health System, the county health department, and all of our community members for helping keep us safe. I do just have a few comments. The case and contact tracing and tracking can be highly labor intensive because there's no substitute for on-the-ground tracking. It can take several hours or even a few days to complete the tracking for one case. So I'm hoping there will be a commitment to hiring the number of staff needed to be able to successfully do that tracing. And this is a rhetorical question, but also a question at some point I think will be answered in the plan is, what role does the county take from an enforcement perspective once individual people have been identified and their contacts and they need to be isolated? The rapid testing for SARS-CoV-2 virus is definitely needed, and I'm appreciating the county's donation to getting the BD Max machine, as well as Colorado Medical, Montezuma County Medical Society, and local private individuals contributing to that machine. However, once we have that machine, and even with the Abbott testing machine, the rapid testing, once available, could become temporarily less available or unavailable. And so any plan would have to flex if that possibility occurs. Just a note on symptom screening, it's not adequate because many people are asymptomatic or minimally symptomatic with this infection. So I understand we have to use something, but I do worry for restaurants and other places where there would potentially be high contact with the public that symptom screening only for employees won't be adequate to protect the public. I do have concerns that having a plan, posting signs, and making requests, that's a lot different. Having those things is a lot different than those things being implemented consistently. And I've seen in local businesses where employers, employees, and customers have not followed those recommendations consistently. So once we do have a reopening, who will be inspecting businesses to make sure they are complying? who will be empowering employees not to go to work or empowering employees to raise concerns if they feel unsafe. And so hopefully there's a mechanism for that. And I just appreciate the consensus about following the governor's recommendations. And I appreciate what I hear as a big commitment to doing the reopening methodically and thoughtfully. So thank you.
Thank you, Robin.
Thank you.
Next, we go to Verinia. Verinia, if you're on the phone, you may speak now if you have something to say to the commissioners. Verinia? Okay, next we'll go down to 970-415-7416. I'm going to unmute you. If you could tell us who you are first, give your name so that the county clerk can get your name. (7416). Nothing from 7416. Okay. Next I will unmute 970-560-0256. Could you give your name so that the clerk can...
What?
0256 with the dog, is there anything that you have that... I'll take that as a no. Okay, so somebody has a dog fight to attend to. 0708, if you're on the phone, 0708, is there anything you would like to say to the commissioners? 0708. Okay. Next we will go to 4777. 4777. Do you have anything you'd like to say to the commissioners?
Thanks, Shaq. This is Karen Dixon with Montezuma County Public Health. First of all, I'd like to thank the commissioners for their thoughtfulness in their decisions. Shaq, I noticed on the chat for Zoom that there were a couple questions that were being asked about graduation, and unfortunately we were waiting for the governor to say something about guidance for graduation, but we do want to mention that Montezuma County Public Health Department has sent out a letter to the school districts in Cortez, Mancos, and Dolores, asking them or providing them with any guidance that they need in order to plan their graduation ceremonies. So we have received information back from Dolores and Mancos schools on what their plans are, and I think we have heard something from Cortez, but we are all waiting for the governor's guidance to see if there's anything that he's going to say first regarding graduations.
Thank you, Karen. Thank you for addressing that.
My pleasure.
Next we go to 970-415-7256.
Is there a way to tell who on this call has a question, or you just have to go through them?
Not if they just called in. Yeah, not if they just called in. Okay, next I'm going to go to 3157. Phone number 3157 if you're on the phone.
Hey, Shaq, can you hear me? This is Joe Bopper.
Yes, sir.
Hey, I just wanted to thank the commissioners, Dr. Aiken, the health department, and Southwest Health Systems for everything they've been doing throughout this event. And if there's anything you need from us, feel free to reach out. Thank you.
Thank you. Let's see, 3157. Next would be 1970. 1970, if you have anything to say, please give your name and then address the commissioners.
Yeah, Shaq, this is Rafe O'Brien.
Okay, go ahead, Rafe.
I just wanted to actually connect with the gentleman who runs the fairgrounds, if you give me 1 second.
Paul, is that what you're suggesting?
Yeah, I think that's what he's suggesting. I think we're already paused.
Hello? Hello? Yeah. Are you there, Shaq?
Yeah.
No, this is Eugene.
Yeah, we can hear
Shaq
both
should
of
be
you.
on the line still, too.
We can hear both of
Shaq, are you
you.
there?
Who's going to speak first, Rafe or Eugene?
Go ahead, Gene, first. And if you guys can hear me, this is Eugene Felker. I'm the current track promoter out at the racetrack. I've been kind of out of the loop. I didn't even know that Larry was no longer the boss out there. I do have a little bit of concern when it comes to what's going on out at the fairgrounds. I just heard something about letting the golf course open, and I'm assuming that's because that's all open and they can practice safe distancing and things like that. I've done a poll, and I have 98% of all of my racers. They said they would race with no fans in the stands. To start with, be social distance out there because the racers do not want to share their little speed secrets with everybody else. And I can't, like a normal business, I can't just go, okay, I'm opening Monday. It's going to take me 3 weeks to prepare that track if I'm allowed to open on the 15th. So my question to the commission, and it's just a question, because of where it's at, the locality, because we're outdoors, we do have the social distancing, would there be any way that we could possibly open to a limited number of people in the fan, if they followed guidelines of social distancing, make everybody wear a mask? Is there a way that we could do it without the fans? The drivers have all agreed to race without the fans. The only one who loses here is me. But it's not about me. I'm doing this for the county, for the community, for the racers.
So, Gene,
there has to be a way. If you can open an arena up to allow riding in the arena, I'm not sure why we couldn't allow something to go on at the racetrack.
Hey, Eugene, Commissioner Silva would like to speak now, so.
Yeah, so we're waiting on the guidelines from the governor to give you an answer if that's permissible or not. So we don't know the answer, and unless, do you know, John?
It is something we will definitely take into consideration.
It depends on how they define these for us, high, medium, or low risk.
Right, he might already.
I'm not sure, I can't read it over my telephone, but I'm not sure what phase Colorado would be in by the time the 15th of May rolls around.
What
Hey, John, turn that off and switch mics.
So we can't answer that either. It's premature, but I can tell you we're on the ball, and as soon as the governor releases his guidelines, we can go back and we can look to see if the racetrack fits in that guidelines. I can speak for the commissioners. If you fit in the guidelines, we would like to see you open.
Right.
But we don't have the answer yet until the governor finishes the guidelines.
Yeah, I think once we know what we're dealing with, and you know what you're dealing with, and you can find a way to fit within the guidelines as required by the state and the governor, then I think we will definitely back you in trying to have your racing season begin and go off as planned. But we'll know more about that Monday when we see what the true guidelines are at this stage, and hopefully we'll be moving into better phases. Hopefully by the 15th of May, we may be in even a more positive posture. So let us see what comes out Monday.
All right. I sure appreciate your guys' time, and I'll try to stay in touch, and I'll just continue to use Rafe O'Brien as my liaison between Montezuma County and me, because I'm kind of out of the loop here. So
I think you should use Shaq Powers, our county administrator. Rafe, I appreciate his efforts and his concern, but I think you need to relay all of your information through Shaq Powers, our administrator.
Hey, Gene, I also have
he definitely has. We are just trying to show a definite front of actually a united group of racers wanting to show that we all come together to do this. A few of us have actually even said that we would donate our winnings back to the track just to keep Mr. Williams going for the year.
Gotcha.
A lot of us are truly just wanting to get back to our normal everyday lives. Some of us in the community don't see this as big of a risk, so some of us would like to go back to our everyday lives, this being one of them. Those are just my 2 cents on what I was going to say, and I'm done.
Okay, thank you, gentlemen.
Thank you, gentlemen. We were very well aware, and as soon as we got the answers, we'll let you know.
Okay, next, I think we're going to go to 1511. 1511, if you have something to say to the commissioners, if you'd give your name and then say who
Make
you
sure
are.
when we have those masks, we have to wear those masks. So make sure you guys are taking them.
Okay, 6627. 6627, if you have anything to say to the commissioners.
Okay.
6627. Okay. I think we've already done 3157, so this might
Yeah,
be the
that was
last
Jay.
one. Yeah, so, okay, so, commissioners, I guess Susan Lysak texted me, she said she had one more thing she'd like to add.
Go ahead, Susan.
Thank you, Commissioners. This is a message to the public. Your businesses need you at this time. So when the restrictions do get lifted, please go out of your way to be able to visit the businesses. If you do social media, I have a call to action for you. I want you to take pictures, tag your businesses, try to promote them online as much as you can. Do a posting that says, I miss ... and whatever that business and whatever that service is. To kind of get their spirits up to help them out would be greatly appreciated.
We really enjoyed what you just said, Susan, and we wholeheartedly agree, the commissioners, so yes, we will all help with that. Thank you. I believe that concludes the comment period.
It does.
Okay, let's go. I'll tell you what, on the agenda, the very last thing we talked about, and that's recommendations for new approaches. So we're all in agreement we're going to be going with the governor's orders, but let's throw some things out there that has been brought to all of us attention, just a few things that we need to work on to improve the plan as we move forward. And so one of the questions is, one of the big ones, it would be restaurants. As the plan states, and I think it's in the second phase, you can have 50 or less people in the plan. And this is, I know it's a preliminary plan, but these people that run these restaurants, they have a lot of good points. One of the first things would be that, well, if you have a restaurant that holds 174 people and you social distance every other table, you can still hold 100, but then you would be out of compliance because it was 100 when the government is saying that it's 50%.
50%, yeah.
In the same token, you could look at that on the other avenue. Does that mean that if you own a restaurant that only holds 30, are you now allowed to hold 50? So, and then one of the third comments with restaurants, there's a lot of them, but is the restaurants are one of the cleanest places of business that we have in the county. They have all the cleaning utensils. They are inspected by our health department for cleanliness, and if they are in violation, they are closed down, and they're struggling. So I hope that this is, as we talk about these new approaches and then recommendations to, I don't know the word that I'm trying to use, but as Montezuma County, everything's different and unique, that we can use some of these comments, and we hope that our constituents would get these out to the commissioners, out to SHAC, out to our chambers of commerce, out to our administrators of the municipalities. And if something just doesn't make sense, because the first thing I can tell you, government's not always right. Government doesn't know more about residents or restaurants than the people that own those restaurants.
I think I have and sorry,
Oh,
I
no,
didn't
go
mean to
ahead.
interrupt you, but I think, and I agree with that. So I think that we have a tool in every municipality, Cortez, Mancos, and Dolores. They all have an occupancy load. So you're right. So if a restaurant can hold 100 or 150 people and they can operate at 50%, why don't we use their occupancy load? So that way it's equal. Everybody, if you can only hold 10, it's 5, but if you can hold 150, it's 75. That way, that moves, because occupancy loads are out there in every business, and that way it is equal. The bigger guy doesn't want to get restricted with just 25 people. That probably won't even be enough for him to feasibly make it, or even to reopen. So I think if we, as we move this forward, use their occupancy load, and it's in all of the city's codes, then we are being equal to all of them. Fair.
Yeah.
So I'd like to throw in some comments if I may, Commissioners.
Yes, Shaq.
So I came up with some bullet points on the fly after our whole plan got changed by the by the governor yesterday. And what I'd like to do is get the administrators and managers, the tribe, the health department, the hospital, and the chambers together, and then take the information that we're getting from the governor's office and from CalFO and identify those businesses, such as the restaurants, that are adversely affected. There's others, such as gyms, that are adversely affected, and reach out to them, see what plans they can come up with, and attempt to draft a plan, because it said to appeal to CDPHE, you have to get the buy-off of the local government, the health department, and the hospital, and use all of us together to put together a plan. And if there isn't a plan, if there's some business that for some reason we can't find a way to help them function, then we need to put the onus back on the state to help support them, because these guys are going under, and they're going under every day. And so we either come up with a plan for them to function, or we come up with a plan to get them some help. But we can't just leave them hanging there. That's unacceptable. And then it says that they want us to have a draft COVID-19 suppression plan that the hospital signs off on, the health department and the local elected officials. Submit that plan back to the board for edit. Make sure you guys are good with it on a case-by-case basis. Help these businesses and submit it to CDPHE and ask them for the exemptions that you're talking about. So if that's by occupancy or whatever, let's do that. Let's put this group together, identify those businesses, restaurants, gyms, whatever they are, and let's submit these plans on their behalf.
Okay, I really like your plan here and your outline of it. Somehow we got to have the input from the businesses themselves. Are they going to reach out to them? Is that how you're going to get that info?
I think that the chambers can work as a liaison with the businesses.
Which I think they already have with the business task force. And if you look at all of those, if you get the opportunity to read those comments, a lot of those businesses have already commented. So I think that the Tri-City Chambers are doing a good job with representing their businesses to bring to forth a plan for us, which is what Susan demonstrated with the
Yeah, I noticed there's one very, very simple kind of a conflict that I saw. Gyms and restaurants are in that very highly bracketed category of no opening at all. But yet in another branch, there is private trainers, and private exercise trainers are still permitted. So we're obviously going to have some of that overlap where you've got a private trainer going into a gym to do private training, which is okay, but maybe can open it on a limited basis, but can't open it up to the public where everybody can come in. You have to have a trainer, and you have to have certain numbers of people in your Purvey 5 or whatever it is that's a legal number to do a private training. So I think there is laxity in how some of the gym or the people that are in workout centers can start to maybe reopen their business. They do it with private trainings and that sort of thing, and then hopefully from that we can springboard them into maybe a greater opening and greater accessibility, provided they take the steps and keep the distancing and the sanitizing and all the things that are required in the plan. So I think there's ways to make this work. We just got to find them.
Which we can then submit that to CDPHE for that exemption. And
Exactly.
I think as the suppression plan, I think, they're going to want to help or to move things forward, still maintaining all of the requirements.
Yeah.
So,
Well,
go ahead. I just need to know exactly what they're looking for in a suppression plan. What are they looking for?
And I think that's where the hospital and the health department
can help us out.
play,
Yeah,
'cause
good.
That's
good.
not my specialty.
Nor mine.
All right, so right here, this is how we move forward from the governor's plan. This
Right.
is the first step. So
Yep. That should
Shaq,
be the,
as a commissioner, we would like you to continue with this. Commissioners?
yeah, if you can organize that, that conglomerate that you just named off after we see what the governor's planning and officially adopt that at our Tuesday meeting, hopefully, then we can see about putting together these agencies that you just referred to and see what we can do about doing the suppression and how we can move forward with maybe helping some other businesses get back open.
And I think it's important in whatever we submit, that if there's for some reason we can't help a business get back open, that the onus is on the state to shut them down to financially support them.
Right, and the governor's got $1.7 billion up there in his coffers that we have sent letters to him, and we do not want him to take that money into the state budget to balance his budget. That money is designed to help counties and help governmental entities and whomever that's being distressed by this pandemic, that's what those monies are for, is to go and help them. So I think we need to really stay on top of that.
And also, too, I think we'll have clear guidance on high, medium, and low risk, because right now we don't. So some of those may actually fall into that as low or medium.
Right.
It's going to be a lot easier to move them forward than obviously if they fall into a high category.
All right. Anything else for the good of our order, commissioners? Jack?
I have
John?
nothing further.
All right, lady, we'll look for a motion then.
I would move we adjourn this meeting.
Second?
There's been a motion and a second to adjourn the meeting. All those in favor?
Aye.
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 Thank you all. Thank you all for participating and listening in.
Thank you.
Last time I had something over my face like this that made me feel this way, my wife had a
Hey,
pillow.
use YouTube.
Your wife had a pillow on you sitting on you. I said, go to sleep, my child, go to sleep.
I'm trying to. I ended the meeting. I didn't get YouTube shut off yet. You got to give me a second.
Shakalaka.